Good evening, everyone. So I have some handouts in the back that speak about coronavirus, fact sheet, keeping your home safe, and also one for who's at higher risk, and that's the elderly, right? Senior citizens, with especially people with underlying chronic diseases, lung disease, diabetes, heart disease, immunocompromised people, okay? Those people are getting hit hard, and you've heard today the man was testifying in Congress. It's not the flu. It's the flu on steroids. So the flu, the coronavirus may kill 10 times the number of people as the flu virus does, okay? So last week, Governor Murphy, you've all been listening to the TV and radio, declared New Jersey a declaration of emergency. New York has the same thing. Today, the World Health Organization declared the coronavirus a pandemic. What does that mean? That means there's sustained person-to-person transmission in many countries around the world, all right? The thing with the coronavirus, it's a novel virus. You'll hear that word novel. That means it's a new virus, right? So all people are susceptible. Nobody has immune antibodies built up, so everyone is susceptible. There is no vaccine. There is no particular treatment, medical treatment. There may be experimental things, but no defined medical treatment. It's all supportive, mostly at this point. While much remains to be unknown about the coronavirus, its impact and epidemiology, the health experts tell us that we should proceed on the assumption, okay, that the virus will spread more broadly around the world, in New Jersey, the United States, and in the community of Long Branch. So what does that mean? It means one of the things is most people, fortunately, for many people, the young people, we're always concerned about young people, they get sick, but they recover, all right? The ones at high risk, like as I mentioned, are the people who are older adults, people who have serious chronic health conditions, right? We think that it's spread as the flu, person to person primarily, which means between two people are in close contact with each other. Somebody coughs, has it, the droplet is spread. You either breathe it in or you touch a surface where the droplet's on, and then you touch your mouth, eyes, nose, this kind of thing. That's how it's transmitted. It may be and may well be transmitted by surface. You see people disinfecting surfaces all the time. How long the virus would live on a surface is no one quite knows, all right? But you see people, as a precaution, disinfecting surfaces all the time. Let's see. Okay. The other thing about the coronavirus is that it has spikes on the outside, if you've ever seen the pictures of the virus. And it appears that those spikes enable it to attach more easily to cells in your body once you get exposed to it. Symptoms to look out for after 2 to 14 days of exposure. If you were exposed to someone who had the disease or maybe picked it up and then the virus and then touched your eyes and your nose or mouth, this kind of thing, it's going to be a fever, persistent cough, and a shortness of breath. It very much mirrors the cold and the flu, so it's very hard to discern what you may have. But if you have any of those conditions, we ask that you stay home, self-isolate yourself, all right? Call your health care provider. You will talk to them. As there is no treatment, there's not a lot of testing. The testing right now is done at the hospitals, but the gatekeeper is the state. So it's not that easy unless you have a specific where they can rule out all other things, and then coronavirus may be the one thing that they suspect. That's going to be one where they're going to test. So the testing is, unfortunately, it's a little limited right now. So you want to call your doctor and you want to get advice because you want to monitor yourself because it can go south very quickly. And you'll know, you're not going to feel well at all, that's when you want to present to the ER room, okay? But call ahead to the ER room. We know from past experience that there's going to be 10 worried well for each sick. person. So if everybody runs to the ER, you're going to overwhelm the system. So you're going to stay home. Most people will recover staying home, and it won't be, it's not going to be a vacation, but it's going to be, you're going to recover. But if you're in that high-risk group, you need to really pay attention to this. So there's an 800 number if you want, 24/7, the poison control hotline, that's in the handout. Remember, what can you do? Your mother told you, your grandmother told you, wash your hands. Frequently wash your hands. I'm meaning wash your hands. The hand sanitizer, I know it's hard to get, but if you can get hand sanitizer, use that. If you anything over 60% alcohol in it is sufficient. Okay. Clean and disinfect surfaces. Bleach is an all-purpose cleaner, disinfector. Clean means you wash with soap and water. Disinfect means you're using some kind of agent. Bleach would be a common thing, 10-to-1 dilution in water. And practice social distancing. In other words, don't go in large crowds. You can see where many events are being canceled, where they have 1,000 people, 4,000 people. That may become more common, even smaller gatherings. But if you can stay, if you have 6 grandchildren, don't bring them over to Nana. Please, don't bring them over there. Don't expose them. Tell them they should, be careful about limiting how much they go out and so forth. So that's where we are right now, kind of all we could tell you. It is a novel. We're learning as we go along. Everything is very dynamic and changing every day. But if you see, Italy is a modern country, right? It's completely shut down, the whole country. Now, we're not there yet in the U.S. or New Jersey. I mean, we only have 23 positives and 1 person who has died. But it could go there. So you will be seeing more. You've seen in New York containment areas, limiting of large events. Don't be shocked. I want you to be prepared if you start seeing those we have an emergency order in place, and you may see those kind of things. Events being canceled, that's happening already, so forth. So if you can, it's not too late, stock up on supplies, because we are doing investigations. It's not just containment anymore, travel restrictions. It's now mitigation, which means if we can identify an infected person, we interview that person, we find out their contacts, close contacts in the last day or two, then we issue a quarantine order to those people to stay home for 14 days. And it's voluntary quarantine with self-monitoring of your temperature and so forth. But if some people violate the quarantine, it's going to be a mandatory court order to stay home quarantine. We haven't done that in the United States in a long time. So maybe since the flu pandemic in 1918 or smallpox. But you need to be prepared. That's where this may be going. What can I say? We hope for the best, but we have to plan for the worst. All right? So,
Thank you.
Mayor, thank you.
Thank you.
Another question?